Good afternoon and welcome everyone to the second edition of Real Talk, an Urban League Twin Cities virtual conversation on a pressing topic of importance to the African American community. My name is Stephen Belton. I'm the President and Chief Executive of the Urban League Twin Cities and your host for this hour. At the onset, I want to point to some available resources for you. A partial list is on the screen, given that our topic is Minnesota's COVID-19 response. And so we've provided a partial list on the screen. We would encourage you to take note of those numbers and websites and to jot them down or to commit them to memory if you have that capacity. There is also the opportunity for you to contact our main number at Urban League Twin Cities for a more expansive list. That number is 612-302-3100. Again, 612-302-3100. Or you can email us at info@ultcmn.org or check our website or for other information. Secondly, I want to remind you of the importance of completing your census. I know the census has been pushed to the sidelines because of the virus, but let's not sacrifice the census in the name of the virus. To the contrary, this is a time when our census is now more than ever important. We know that the census is going to end at some point, and then the post-census, the virus is going to end, not the census. The census will also end, but let me clarify, the virus, the COVID, the Rona will end at some point, and then the environment of the post-Rona context, they are going to allocate resources to address what has happened, to address the devastation that has occurred in some communities as a result of the virus. And those resources will be allocated on the basis of our census count. And so if we don't stand up to be counted, we are not counted. And so if you want to count, you need to stand up and be counted. And so my encouragement to all of you is to please complete the census forms. They have been mailing you, they have been calling you. Some people may have experienced folks knocking at your door, but please do that. African Americans need to be counted. I also want to remind you that this is a conversation. It's meant to be, while we have a panel of esteemed experts, it's meant to be a conversation, and you can participate by using the chat box that is on the Zoom app. It's usually at the bottom of your screen where it says chat, and you can write a question in there. Please note that your questions will be available to be seen by anybody. We have about 100 people who are on this call, and so all of them will be able to see that. But that's a way to get your questions in. We are also using Facebook Live, and so you can also get your questions, write your questions via Facebook. We have a moderator, Marquita Stevens, who's on the line, who will be moderating those questions as well. Well, today's show, if we can pivot, is a deeper dive into the physical impacts of the Rona, as we like to call it. Many of your questions during the last Real Talk conversation indicated your interest in having more information about the impact of the virus on the physical and mental health of African Americans. And today we're going to focus on physical health. We will talk about, we wanted, given the layers and the nuances of that subject alone, we thought it was important to separate a conversation about physical health from mental health. And so today, physical health, the next Real Talk in 2 weeks will highlight mental health impacts and strategies. Yesterday, at the end of April, there were a total of 5,136 diagnosed cases of COVID-19 in Minnesota, including 343 deaths. The largest percentage of confirmed cases and deaths are in Hennepin County, Minneapolis, followed by Nobles County, which is located in southwest Minnesota, which had almost twice as many cases as the next largest county, which was Ramsey County. African Americans at this point, at least at this point in the count, constitute 14% of the cases in Minnesota and 5% of the deaths, making us the highest percentage next to whites. And I might note that the racial identity of nearly a quarter of all diagnosed cases and deaths are labeled as unknown or missing, which tells us that the data set that we have available to us is incomplete and inaccurate so far. And there could indeed, we expect that there is a higher percentage of impacts on particular groups such as African Americans. Nationally, we have seen in some urban communities data showing that Black people are contracting the virus at a rate 2 times as high as their percentage in the population. And in some communities, deaths are occurring at up to 3 times the percentage of Black people in the population. Now, a model created by an interdisciplinary team at the University of Minnesota School of Public Health and the Minnesota Department of Health, released on April 10, makes 3 critical points about the pandemic. First, that the pandemic is expected to have a long-term impact on Minnesota because of how easily the virus spreads and because of its high mortality rate, or how fatal it is. Second, social distancing policies and guidelines will lead to a later peak of deaths, or a later peak of cases, I should say, and hospitalizations and ICU care. But third, and this is important here, the long-term social distancing measures may be effective in reducing the speed by which the infection is transmitted, but they will also mean that the pandemic will last much longer. A critical data point for us at this point is that so far, only 70,000 tests, it's about 71,000, have been conducted in the state of Minnesota out of a population of 5.6 million people. That means slightly more than 1% of the population has been tested. So 1%, I'm not a math major. I'd leave it to our panelists to correct me if I'm wrong, but I think that's 1 in 100 have been tested, which means 99 out of 100 have not been tested. The percentage of deaths increases with age, and in Minnesota, slightly more males than females have contracted the virus. And of course, we know that for people with poor health conditions such as heart illness, HIV, AIDS, diabetes, hypertension, and asthma, in other words, kind of the core conditions that impact Black people. If you got the sugar, or if you got high blood, you are in the high risk group, and the virus can mean more severe health impacts, and it can mean if you get it, there's a higher chance of death. So here to make sense of all this are 3 people, each of them experts in their fields, who share a common commitment to community health and wellness and to personal health and well-being. Let me introduce them to you. Rachel Hardiman is an assistant professor in the Division of Health Policy and Management at the University of Minnesota School of Public Health. She holds both master's and doctorate degrees in public health from the University of Minnesota. She was born and raised in Minneapolis, and Dr. Hardiman's research focus is on racism as a critical and complex determinant of health inequity. Ayana Kwamina is a naturopathic doctor specializing in family practice. She earned her medical degree from Southwest College of Naturopathic Medicine, and she treats her patients with a variety of effective modalities, including botanical medicine, homeopathy, nutrition, and lifestyle management. Dr. Kwamina left Minnesota. Let me say that again. Dr. Kwamina left Minnesota about 1.5 years ago for the warmer climes of Las Vegas, Nevada. And then Jamie Slaughter AC is an epidemiologist at the University of Minnesota School of Public Health. She is a recent transplant to the Twin Cities from Philadelphia. So all you dirty birds out there, give us some love. She earned her doctorate in maternal and child health epidemiology from the University of Illinois in Chicago. And Dr. Slaughter AC researches health inequity and investigate social environmental determinants of women's and family health. So welcome to Real Talk, Dr. Hardiman, Dr. Kwamina, and Dr. Slaughter AC. That's a time when you can say, thank you, yeah, good to be here.
Thank you.
Takes a second to unmute yourself first.
In other words, it was a cue to unmute yourself.
Noted.
Noted.
So welcome to each of you. Before we get started with our discussion, I want to remind our audience that you can submit questions. Again, this is a reminder to our panelists using the chat feature on Zoom or the comment box on Facebook Live. Questions also were solicited from you when you registered for this conference, and we will put those questions to our panelists throughout this discussion as time allows. So let's jump right in. I want to begin with a question for Dr. Hardiman. What are the risks associated with the virus from a public health perspective? And if you would please put it in language that we can repeat. I like that line from that movie Philadelphia with Denzel Washington. We said, talk to me like I'm a 4-year-old.
Absolutely. So, when we think about this from a public health perspective and, what those risk factors are, a lot of it is what we know about sort of having a common cold, right? And having a virus that makes us sick. But then, there's an added layer here that what we're seeing is that people who may, as you mentioned, already have some sort of underlying condition like diabetes or, high blood pressure, that those risk factors are going to put people in a more vulnerable or riskier position with potential to both contract the virus and have worse outcomes as a result.
One of our listeners, Sandra Culverson, asked Dr. Hardiman, how can we encourage more of our Black and Brown communities to stay at home and understand the severity of the pandemic? And if I were to sort of tag on to her question, how do we get Black folk to take this thing seriously?
Yeah, that's it. That is a question that I would love to hear Dr. Slaughter AC's thoughts on this too, because it's a question that I think we've grappled with quite a bit. I think there's a couple of things happening. One is that there's a lot of people who just can't stay home just because of the types of jobs that folks are working and the requirements there and being essential workers. So there's that piece of it. And then, it's not a natural thing to stay home. That's not, it's sort of not part of our, for most of us, I think it's not part of our human nature. So getting folks to really understand that as a community, we have to work together to be able to be healthy in the long run, I think is one of the main messages that we need to be promoting among the Black community.
Yeah, some of us are more introverted than others, but you make a good point that even for an introvert like myself, it is not natural to have to stay at home,
right,
to want to stay at home. So we really are talking about a behavioral change and a decision that has to be made. Let me turn to you now, Dr. Slaughter AC. Could you describe from an epidemiologist's perspective, how exactly is the virus spread? It seems to me there's a lot of information and misinformation about it. One of the questions that one of the people who's on the call asked is it airborne? And I know that I've read articles about the possibility of it being spread via air conditioning. And, as we get, this is an issue that Dr. Kwamina is already dealing with, air conditioning in Las Vegas, but we haven't quite gotten the air conditioning season here. And it makes me wonder, I'm sure it's giving other people pause and wonder, is it spread, is it airborne, and is air conditioning a factor? But if you could just tell us a little bit, how is this virus spread? You've got to unmute. You're still on mute, Dr. Slaughter AC. There you go.
Okay, there we go. Okay.
Yeah. Welcome.
So there's for the most part, there's a lot of things that we don't know about this novel coronavirus. But the predominant way, or the main way in which one is exposed by this virus is through the droplets that one produces when someone is infected, sneezes or coughs, and that I guess the disbursement of those droplets can be any up to about 6 feet from a person when they sneeze. And so that's one of the reasons why in social distancing, we have the recommendation of staying 6 feet apart from each other. You know, the research is starting to showing that the virus does live on surfaces. So it has a longer lifespan on metal surfaces, shorter lifespan on surfaces like paper. And so that's why it's really important for you to take a cleanser, like a Clorox or Lysol, and wipe down doorknobs, sink faucets where you wash your hands, the bottle of soap that you use, at least a couple of times a day, especially if you are leaving your home and coming back in, or you have other people that come back in. But it's not, so we don't know enough to really say or extrapolate beyond that in terms of how this virus is spread outside of the droplets that one produces if they're infected, as well as, you know, when we cough and touch, you know, cover our mouths with our hands, and then we touch a surface, and then someone else comes along with that. The other thing that I want to just say, because I see a lot of people doing this when I venture out for essential needs, is that some people are wearing gloves on their hands in an effort to prevent themselves from coming in contact with surfaces that may be carrying the virus. And so what I want to say there is that that method is only effective if you change your gloves every time you finish touching a surface and move into a different environment. Otherwise,
because you're carrying the germs from the gloves with you, or carrying the
yes,
yeah, got it.
Exactly. So when you have gloves on, you know, latex gloves on, and you touch a surface that it could have the virus on it, it definitely has other germs on it, right?
Right.
You are picking those germs up on that latex glove. And when you go and touch another surface, right, you are transferring those germs and possibly the virus to that other surface. And so the reason why, you know, there's been a huge call for PPE, right, at hospitals. And the reason why hospitals—
PPE is personal protective equipment.
Right.
Yep.
The reason why they're burning through that PPE so quickly is because after contact with each patient, they are throwing those gloves out, and before they move on to the next patient, they are putting on new gloves so that they can minimize the risk of transferring the virus to another patient. So you're actually better off if you're going into a store to get groceries. You're better off being gloveless. Bring your hand sanitizer with you, right? Use your hand sanitizer as soon as you are done with your shopping or you make your purchases. Wipe down your credit card if you had to pull that out, and wash your hands immediately, or once you get into a space where you have water and soap.
So all this soaping of hands, washing of hands, and particularly the hand sanitizer has created another sub-pandemic from my perspective, and that's the pandemic of ashiness. This is real talk, all by the way. So, I mean, I'm seeing a whole lot of ashy Black folk out there, myself included. And so I'm just saying, I'm just putting it out there. I'm not saying it rises to the level of the Rona, but there is an ash pandemic out there. I'm just putting it out there. Dr. Kwamina, let me bring you into the conversation and ask this question. What role does the immune system play in the transmission, even the resistance, and also the recovery of coronavirus?
Well, it plays a huge role. I mean, your immune system is there to prevent you from catching things and also to fight off what you may catch. I wanted to add on with the gloves. I'm seeing a lot of patients, a lot of people outside who are also wearing their masks, but they're wearing them right here and they're not covering their noses. So you're still inhaling everything through the nose while you're covering your mouth. So you want to cover everything and keep it completely covered. Otherwise, it doesn't make a difference. So quick note on that. So yeah, otherwise the immune system is extremely important. It's the thing that's going to fight off whatever you're going to inhale or touch. Does that answer your question?
Yeah, it does. One of our participants in the call named Richardson, no first name, asked a related question. Why is there not enough focus on the lymphatic system? And wants to know in particular what vitamins and herbs help build the immune system.
So there are there's all kinds of things that can affect and assist the immune system. Mother Nature has given us a plethora or a lot of things to help us. The trick is, because we're learning about coronavirus or the COVID virus as we're going, it's difficult to know if what's available is going to affect this particular virus. So I'm learning things as each day goes on. Just last night, I was getting ready for this talk, and what I was giving my patients, I'm learning now may not be helping them as much as I thought. So the two things that I'm kind of settled on to give to my patients now is elderberry and zinc. So everyone knows about the zinc. Zinc is pretty much off the shelves these days. It's really hard to find. But it may help to understand the reasons why those two things are really helping and why I suggest those two aside of vitamin D or vitamin A or vitamin C. Elderberry, for one, helps helps keep the virus from attaching onto the cell. So the way that viruses get into your cells and help and affect your body is it attaches onto the outside of the cell and basically injects its insides into the cell. It replicates or copies itself and then busts out of the cell alien style, if you will, and throughout the body. So you want to take something like elderberry to help prevent the virus from attaching on. And then zinc helps while it's in this, if you have zinc inside your cell, zinc will help to prevent the virus from copying and replicating.
Let me just interject real quick question. So how do you ingest elderberry? Elderberry sounds like something you put on a hot biscuit to me. So I'm taking that's not the case. How do you take elderberry?
Elderberry is actually, it's a berry. So it's a lot like blueberries or blackberries. It's a little berry. Actually, a lot of elderberry grows in Minnesota. So you can get it relatively easily. It's got a sweet little taste. You can do elderberry jam. You can do elderberry tea, tincture, which is a liquid tincture, kind of like this. So it comes like this. You can do capsules. So all kinds of things, actually.
Good. Helpful. So my biscuits are not out of the question yet.
No, you can still have your biscuits, but you can put the elderberry on top of it for sure.
I want to go back to a question to Dr. Slaughter-Acey. Could you explain, we're hearing a lot about this 18-month projection now, and so this is part of the modeling that's out there. Both public officials in both nationally and here in Minnesota are saying that we could be dealing with the virus either directly or indirectly for a span of 18 months. I've heard even longer than that. Could you break that down for us when they say this 18-month projection? Could you break down what are they talking about and how are they basing their time? And here's the question that somebody wants to ask: when does that 18 months start? Are we like 3 months into it? Are we like 9 months into it? Or is it going to start day after tomorrow? Break it down for us. You're on mute again. Dr. Slaughter-AC, you're on mute. You're nodding your head.
Unmute. There we go.
There we
I don't,
go.
for some reason, when I press the unmute button, it doesn't let me unmute myself.
See, that's the devil trying to keep you from talking. We're going to rebuke him.
Yeah, exactly. Exactly.
In the name. Go ahead.
So, so in terms of this 18-month, 15 to 18-month time span, so that comes from this idea of developing what we call in epidemiology sort of herd immunity to a virus. And herd immunity is when you have a certain percentage of our population has become immune to a virus. That group then winds up protecting other people who are not immune, because it slows the transmission of a virus, because there's just not enough people who are susceptible to get it, right? And usually for something like herd immunity, we're looking at around 70% of the population to have it. The other way that we can, so there's two ways that we can reach that sort of herd immunity. And one process is by people becoming infected with the virus and recovering and going back out into the community, right, with their antibodies or their newfound or acquired immunity. The other way that a person that we can build herd immunity is through vaccinations. So this is why when we think about measles or polio, there's a real push for us to have our children vaccinated, at different time points after their birth through getting into before they start school, so that we can help to maintain this sort of herd immunity against these viral diseases and limit their potential effects or the potential for outbreaks. And because the novel coronavirus is brand new, it's new to the scene, we as a population around the world do not have, because no one's had it, right? We don't have, we weren't able to develop our own immunity to it by having previously acquired SARS-CoV, SARS-CoV-2, the big long the coronavirus, right?
So we're nowhere near the 70% that you'd like to have in order to be able to protect the 30%. Is that
right? Exactly. Exactly. And so, so that means that in order to get to that 70%, we need a vaccine, right? And there is the process to develop a vaccine is going to take about 15 to 18 months. And so in terms of have we started our 15 to 18 months, we've probably started it, but we're probably in month 2 or max.
See, I ain't trying to hear that. We need to do a reset. We need to do a reset where we're like in the month 6 or 7 or something. Month 2, that's kind of distressing. Now, I'm interested in this notion of trying to create a virus, given that we have a chief executive officer of the country who's recommending that people take Trump teenies and mix a little Lysol and you know, and a little scrubbing bubbles and take a cocktail and it'll get done. But it sounds like you're suggesting a more scientific approach will be required to actually get something that really works for people. This ain't a matter of just, you know, dabbing a little tussin, a little Robitussin on it. We're actually going to have scientific trials and studies to get something done. And that the outlook is probably more akin to something in the 18-month horizon, depending on how we count that. Is that a way of understanding this?
Yes, absolutely. So it's, you know, we could actually have a vaccine that works, you know, developed in the next 6 months, but there's a process of going through clinical trials and systematically testing this to make sure that if we, you know, give people a vaccine, this vaccine, it's not going to cause more harm to them than having the virus, right? That's the last thing that we want to do, is cause harm to people. And so that's part of why we're having this 15-month to 18-month time frame. The other piece of it too is that once we get something that's approved by the FDA and that's ready to be administered, there's a whole aspect of distribution that we have to look to, and ramping up the supply and being able to distribute it to people in our communities, and making sure that it is not just people who have access to a clinical provider or
it's not just NBA players and
exactly.
and celebrities. We're definitely going to need to have the three of you back at the point in time when they actually have a something to address this, a vaccine, because there's also the entire cultural context of introducing a vaccine to an African-American community that is historically and justifiably distrustful of the healthcare system. But let me go back to redirect a question to Doc Hardiman. I can call her Doc like that because you know we're familiar now. See, we've been on the air together for a few minutes. So Doc Hardiman, if you, one of the things I'm interested in that people who are on this call have been interested in is the modeling that's being touted by the state of Minnesota. And we have a governor that, from my perspective, thankfully is saying that he's driven not by dates, but by data. And so the data that he's using, the question is whether or not that data has taken in the specific cultural context. And so one writer asked, and I would echo this question about whether or not they are specifically looking at the disproportionate impacts in the African-American community. And that, of course, raises the problem that in Minnesota, I don't know about in the state of Nevada or elsewhere, but I know in Minnesota, I have personally written the governor and the commissioner of health to request, I know Dr. Hardiman, you have as well, to request that they disaggregate the data that is coming out. Right now, State Department of Public Health only publishes every day a report that just lists the total number of cases, total number of deaths, and then the percentage that are African American. But we don't know where those occurred. And they have the capacity to disaggregate it by not only by county and city, but probably by census tracts, which would be most helpful. So that's a long-winded way around of asking you, Dr. Hardiman, whether or not the modeling that is being done contemplates or takes into consideration these disproportionate impacts that are happening in the African-American community.
So I think there's two different responses to that. First, I think the modeling that's being done by my colleagues and Dr. Slaughter-Acey's colleagues at the School of Public Health doesn't, I don't know that it specifically takes into account the potential for disproportionate impact in certain communities. It's really modeling, and Dr. Slaughter-Acey, feel free to correct me if you have other details, but that those models particularly are looking at the resources, they're looking at PPE, they're looking at ICU beds, we're looking at nursing homes and long-term care facilities and those sorts of things to be able to understand sort of when the peaks for folks who are going to be infected with the virus, when that's going to happen, and how those surges are going to play out with our healthcare system and the capacity of our healthcare system to care for all those folks. I think that the data piece with respect to race and disaggregating that is incredibly important. I'm working on requesting the data. I have colleagues that are, and we're starting to see some of that trickling in. I think right now we have a lot of data issues, not just the race data, but just from the, kind of just purely from a very, public health standpoint, we are, because not everyone is being tested right now, we don't have, we're piecemealing things together to get an understanding of what's going on. But what I can say is that given what we're seeing in cities like Milwaukee and in New Orleans and in Georgia, where Black and Brown communities are disproportionately being impacted by COVID-19, we fully expect the same thing, unfortunately, to play out here. And I think as each day goes by, we're getting closer to being able to have those numbers and able to report them.
One of the remedies, thank you, one of the remedies that are the helps that is being touted in the among public health officials is one of the new terms actually that's being bandied about. So you're all aware that COVID-19 has introduced all these new terms into the public lexicon, like social distancing and flattening the curve. Well, another one that we're beginning to hear more about in particular is this idea of contact tracing. And I would pose this question to Dr. Kwamina from her perspective as a practitioner. First, tell us a little bit about what is contact tracing, and from a practitioner's perspective, someone who sees patients every day, how do you regard this, and what are sort of the impediments or the barriers to getting more of it done?
Well, contacting basically is a way to track your movement. So it's a way to find out, for instance, if you've gotten the virus, where have you been, to find out if who else you may have possibly given it to or transmitted it to. So it's a way to try to basically trace your contacts. It's hard in reality, because when you're going out and getting your essentials such as groceries, I'm going to Trader Joe's, I'm going to Target, I'm going to a few different places, somewhere else on the way. And that's what attention and being honest. So it can be that's it's also was like the other doctor was saying, that it's hard to then replicate that information into that, because we're living in reality and we're not numbers. So I'm just a person. I'm not necessarily paying attention, especially if I'm not in the know. If I'm just a lay person, I'm not paying attention to all the places I'm going to every single day. And then the days go on. So you may have received the infection, but not noticing any symptoms for days later. So you may not know to pay attention what you were doing 3 days ago or 5 days ago. So it just makes the whole thing a little bit more complicated.
Go ahead.
Yeah, okay. I was just gonna say, to help that is to, jot down where you're going, what you're doing, and stay home. So that helps, that helps really lower the amount of contact that you're having overall.
So one of the ways that is that they've used in China as an example, and one of the ways that is being used in Europe as well to extend this contact tracing, really gets into this border, this tension between public privacy and personal privacy and public health. And so they are tracking they're confiscating cell phones. They're looking at your credit cards. And so the idea is to find out everyone that you've been in contact with who possibly could be infected by the virus, to give them notice, to be able to monitor them, to test them, maybe take their temperature, and if necessary and appropriate, to socially isolate. I would just throw it out for the three of you, or any of you want to respond. What do you think of, where's the bright line, if there is one, between personal privacy, sort of those are my contacts in my phone, and that's my credit card purchase. I don't necessarily even know or remember all the places I've use my credit card, but is that personal information or is that public information? How do you balance those?
I think it's a really good question that's posed. And I think whenever you're talking about public health or basically whenever you're talking about public health or public policy, you're trying to balance right to privacy with the public good. And then I'll say it's a fine line that exists between the two of those, but it's not a clear line that exists between the two of them. And so, you know, while, and I think what makes it also much more difficult or more complex here in the United States is that we have in our culture, we've sort of bred this idea of freedom and a right to privacy that may not be as explicitly written into our Constitution, but we live by that, right? So I think another thing that, so knowing that, one of the things that companies like Apple and Google are proposing with their platforms that could be used for contact tracing is opt-in options. So you know, in terms of the access to your contacts, where you went, all that sort of thing, it's only available, that information is only available if you choose to opt in. So that's one thing. Another aspect of this is once you opt in, right, what's going to happen with my data? And I think within communities of color, especially Black African American communities, there is distrust in terms of what are you going to do with my data because of the way that we have been systematically treated in this country. And will that data be used for other purposes besides contact tracing?
Absolutely, absolutely. That's a fair, I mean, as I said, we've got historic and justifiable distrust of authority in general, and not to mention the particular challenges that many of us have with the specific administration. I want to get to some questions. I'm going to turn to Marquita Stevens in a moment. We only have about 9 minutes remaining. I want to get to a couple of questions, at least from others who are on, you know, in the Zoom chat. But I'd be remiss if I didn't observe in this opportunity that we have 3 extraordinary African-American women experts on this panel, and represent, and what I want to lift up is that women are also disproportionately impacted. And so a lot of the high face time positions, you know, like, you know, that require high touch positions is what I meant to say, are occupied by women. So you think about who's occupying nursing homes and care facilities, who's cleaning up hotel rooms, who's doing all these kinds of work are held by women. I'd just be interested in your perspective, and not so much on the impacts, but if you have some words of encouragement or suggestions that are things that you are saying to each other or to women in this community to be careful and to make their way through this.
For one thing, I mean, that's my sweet spot. Obviously, I'm an African-American woman and I know our struggles, and a lot of the conditions I see are from us doing too much and taking too much and pushing everything down and not paying attention to ourselves. And so it's really, really important these days. Do the basics for yourself. I know you got to go out there and work, you got to take care of your family, but you also need to rest. You need to get your sleep, and you need to take care of your stress management. You got to keep your body, I need to keep my body as healthy as possible. Not just for this situation, but for, you know, going forward, because the more that we're not taking care of ourselves and paying attention to ourselves, the more we are to taking on those more chronic conditions and wearing our system down over and over and over as time goes on. So those basic things like sleep, you want to get between 7 to 9 hours. I'm getting a good 10 hours these days if I can.
So you need to can you unpack that? How are you getting 10 hours of sleep? You must not have baby kids at your house, you know.
I put them to bed early. Yes, I have to when I can, when my schedule allows. If I'm scheduling patients later in the day, so I'm doing video calls for that. I'm getting in bed earlier. And I'm also taking care of my diet, so making sure I'm not eating inflammatory foods, watching my sugar intake, my alcohol intake, You want to be eating whole foods like your leafy greens. I'm doing a smoothie in the morning with blueberries with high antioxidants. You want to be drinking your water. I'm doing yoga to make sure that I'm not taking in and holding in my stressors. Find that girlfriend, talk to her, cry, scream, laugh, do those things. It's so important these days.
Thank you.
And I would
So
also
go ahead.
I would just also add, I think in addition to all of what Dr. Kwamina just shared, it's important for, women who have to go to work, right? And are those attendants in nursing homes or, wherever that might be. If something isn't feeling right, or if, there is some sort of, if the right sort of safety procedures and things aren't in place, it's okay to speak up, and it's important to speak up and to let folks know, because this is, it's bigger than one person. And I think Dr. Slaughter-Acey referred to this public good and the need to really think about both ourselves and how the actions of our employers or those others in our community can really impact, it's a ripple effect. And so we're all in this together.
And I'll just say that, when you feel that you're an individual and you feel vulnerable, right? Because of the situation that you're in, the collective is what's so important. So bringing all those individual voices together, right? Finding that person that you can talk to, that can offer you compassion and empathy. That's really important. Even if you don't have, if you're not in a position in which you can work from home, right? Being able to talk with somebody, identify with other people who are in your shoes, speaking up, because there's a lot of people speaking up right now. And the collective voice is what's going to protect the most vulnerable of us. And then the other piece I'll say that was a little bit attached to the contact tracing piece of it, but there is you can also use it as a resilience resource. It's keeping a diary, right? So each day, right, you can, talk about where'd you go, who did you meet with, that sort of thing. And with respect to contact tracing, but use that day to talk about your feelings. Did you wake up feeling like, not so good of a word, right? Did you feel like you were riding the struggle bus? Yesterday I felt exhausted and I kept saying I was exhausted and I was on a struggle bus. And so I closed my laptop because I as an epidemiologist, I can't handle any more numbers.
So my question would be, were you social distancing when you were on that struggle bus? So
I was social distancing.
All right then.
Struggle bus.
I did have somebody texted me, wanted to know from Dr. Kwamina if Krispy Kremes count as a whole food. So I'm gonna answer that for you. I'm gonna just answer.
No.
So, listen, unfortunately, we are out of time. This has been a rich conversation. I feel like we could do this again tomorrow and still continue to mine the depths of this. I want to thank each of our guests, each of our resident experts for this call, Dr. Ayana Kwamina, Dr. Rachel Hardiman, and Dr. Jamie Slaughter-Acey. You have exceeded my expectations, which are always high, but also I think lifted us up with both your candor and your insight and the obvious intelligence that you bring to this. So let me just close out by acknowledging that this sheltering in place and this pandemic is hard. It is new ground for all of us. Social distancing is not something that as an African-American people is natural to our heredity or to our outlook. We do just the opposite. We want to be socially close with one another. But in the context of this pandemic, some of us have lost jobs. Some of us have lost loved ones. All of us have lost mobility, and at the same time have lost a sense of the familiar and our sense of security. It has been hard for everyone, but I want to encourage you to be strong and to be hopeful. This pandemic will pass. We will find a vaccine, and there will be a return to normal, even though that normal will be different. But I want us to remember that as a Black people, we survived the transatlantic slave trade, the Middle Passage, the terrorism of chattel slavery, the pandemic of Jim Crow lynching, the struggle for civil rights and voting rights, and the current pandemic of systemic inequities in education, housing, employment, health, and wealth. We have been through some stuff, but by the grace of God, we will get through the Rona. So I invite you to share this program with others. It will be posted on our website and on our Facebook page, and we'll be back again in 2 weeks with another Real Talk. Please take the messages and the information that you have heard from this esteemed panel of experts and share them with your friends and your loved ones. And I like with each of our experts, it says, call your girlfriend. And brothers, I would say, call your boy and share this information and be real. Don't stop the Real Talk here. Complete the Real Talk in your personal circles of influence. And then finally, talk to your children, talk to the elders and the others who are in your circle of influence. Many of them are struggling and don't have the vocabulary or the worldview or the experience to express how they're struggling. So lean into them, pay attention to them, step back from your own sense of dislocation in this moment and consider what they are going through. Listen to them. So be blessed, sisters and brothers, and we'll be back in 2 weeks for another Real Talk. Thank you.
Thank you.
Thank you.
Thank you.